Okay guys, I'm here to talk about my first visit with the transplant doctor and my first and only consolidation treatment that I went through. So as you can see, I am representing WVU Medicine, WVU Healthcare. Not only is WVU my alma mater, there it is. They are also the transplant center that I went to for consultation, and they are actually who I had my transplant with. I was in the hospital there in Morgantown for almost a month, and then I stayed in Morgantown after my transplant also, but that's another video. What I'm going to talk about here first is the very first visit I had with my transplant team. And like I mentioned in the last vlog, at that very first visit, I did not know if I was going to be having a transplant yet or not. The doctor there, he was kind of going to be the one who made that decision. Transplants are his specialty. They are what he does. He is the leukemia guy, and lymphoma and other, cancers that require a bone marrow / stem cell transplant. But he is the man, and they absolutely saved my life. But like I said, I'll get to that more later on. But anyways, so I went to my first appointment there and met with them, and I was so impressed from the very beginning. The doctor, he really sat down and he wrote out a paper for me. He talked me through everything. He talked me through my diagnosis and what exactly it meant. He talked about the monosomy 7 and how that complicated things, but he talked about how I am in remission. He talked about the statistics for people who do the consolidation route versus bone marrow route, all that stuff, and it was just a really good experience. He is so knowledgeable. He's the man, and I'm so glad that I went there. But what he talked about, I'm going to read you some of the statistics that he said and kind of try to explain the way we came to the transplant decision. Like I said, there's two different routes you could take. There's the transplant, and then there's the consolidation chemo. Transplant, there's a lot involved with it, but basically what that means is they would be wiping out my own blood system, and they would be replacing it with the blood system of a donor. And a lot of people, whenever I was talking about transplant and whatnot, a lot of people had the misconception that transplant is based on your blood type, and it is absolutely not. Transplant, and the way they find a donor, is actually based on something called your HLA type. And HLA stands for Human Leukemia A. I cannot remember what the last one, what the A stands for, but it's not your blood type. And they look for many different matches. I'm not sure exactly what all of them are. I just know that he told me that, of course, I'm a Caucasian, and that for Caucasians, they typically find donors for 80% of people who are in need of donors. However, unfortunately, for people who are minorities, it's the amount of donors that match is a lot lower. I'm not quite sure why. I think it just has to do with the number of people who are on the who are donors and on the Be the Match donor registry. And I'm going to get on my soapbox here for a second and really preach at you, and I'm sorry for that ahead of time, but I just want to stress the importance of becoming a donor if you're able to. If you are a healthy young adult, please, please, please look into signing up to be a bone marrow donor. Honestly, donating marrow, it's not that bad, and it's not scary. There's not usually any kind of surgery involved. For the most part, they don't have to stick any kind of needle into your bones. It's nothing like that. It's very, very similar to giving blood, actually. They will give you shots to increase your stem cell amounts, to really jack them up. And then they will hook you up to a machine. So one arm you will have a needle in, and it's going to take blood out, and it's going to go through this machine and cycle and separate all these stem cells out from your blood. And then there's going to be another tube, and it's going to put the rest of your blood products back into your body. So one arm is going to be hooked up this way, and the other one's going to be hooked up that way, and they're just going to, I guess, kind of centrifuge or separate out all of those stem cells, and that is what you donate. And it just takes a couple hours of your time, and honestly, you are saving someone's life. Literally saving someone's life whenever you donate. So I cannot stress it enough, and I just can't thank everybody who is on the registry enough, and especially my donor. I don't know my donor. My donor is unrelated. All I know is that it's a male donor, and that he is from outside of the United States. So a complete and utter stranger donated these stem cells to me and saved my life. So I'll stop preaching now. I just want you all to understand how simple donating is and how impactful it is. So please, if you can, if you're able to, please just look into signing up for Be the Match. I think it's bethematch.org maybe is the website. And all you have to do to become a donor is to fill out just some information, and then you just do cheek swabs. You do 4 swabs, up, down, and then up, down, and then you mail those swabs back, and then that's pretty much it. It's really simple, so just please, 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 please be a lifesaver. So, okay, sorry. I'll get back on topic now. Okay, so there was 80% chance that they would find me a donor. And he just, explained the whole transplant process to me, the medications and the chemos I would be getting pre-transplant, things like that, how long the recovery period would be. He estimated that from the start of everything until my discharge would be approximately 2 to 3 weeks. And all in all, that really wasn't too far off. I was in the hospital for transplant less than a month. So, he knows his stuff. Absolutely knows his stuff. And then he just talked about, several complications that could come from transplant. Of course, number 1 being infection. Number 2, complication that he said 50% of people develop this, but it's treatable in 80 to 90% of people who develop it, and that is graft versus host disease, so GVHD for short. And GVHD is whenever the donor cells actually attack the recipient cells. So it can attack the skin, the liver, intestines. It can affect your eyes, your mouth. Pretty much any system or organ in your body, it has potential for GVHD to attack. There's 2 different kinds. If GVHD were to occur early on in the transplant process, it would be called acute GVHD, and if it occurred later on in the transplant process, it would be called chronic GVHD. And the symptoms just vary depending upon whether it's acute or chronic and things like that. But like I said, he had told me that 50% of people, of transplant recipients, suffer from GVHD. So that was a big complication that could happen. Of course, rejection of the stem cells, that could happen. They do have you on immunosuppressant drugs to prevent that, but it's still a real concern. And then, of course, relapse of AML. He said that in my case, all these numbers are, for me, they may not be necessarily the statistics for someone else who has AML, but this is what he told me, so I'm just sharing that with you. He said that the disease could come back despite the transplant in approximately 20% of patients. So that's a risk to take. He said that what did he say? He said without transplant, my chance of relapse would be about 90% or greater. And that is just because AML itself, like I said before, AML is really an aggressive form of leukemia. And also, I had the monosomy 7 issue with my leukemia cells, so that increased the chance of relapse. And then my history of blood disorder also increased my chance of relapse. So there was maybe a 10%, maybe a little bit less than that chance that if I did the consolidation chemo, that my cancer would stay away. So there just really wasn't a real logical, reasonable option. You know what I mean? I knew I had to do transplant because I knew that, I'm not taking that risk. I have a lot of life that I want to live after this, so transplant, as scary as it is and as intense as it's going to be, that's the way I need to go. And I knew that from that very first meeting. And everyone was really on board with that too and very supportive. But I'll still explain the consolidation chemo a little bit. For some people, that is an excellent option for them. Some people don't have those complicating factors like I did. And so they're able to do, consolidation chemo and keep the AML away, which is awesome. Consolidation chemo, for me, the way they explained it to me was that it would be 4 rounds of chemotherapy on 4 separate stays. Each stay would be 1 week long in the hospital, and I would receive chemo. So I would receive this cytarabine again. I'd receive cytarabine chemotherapy for that week, and then I would be sent home to recover from my chemo. So that recovery would take about 3 weeks, and then once I am recovered, I would go back to the hospital and get my second round of cytarabine for a week inpatient, and then be sent home again to recover for the next 3 weeks, and so on and so forth. I would do that for 4 rounds. And then once I complete that, that would be it. I wouldn't have to do any more chemo. The cytarabine would, have killed off all of the possible, leukemia cells that might be lingering somewhere in my body. It would take care of it, and that would be that. So of course, that was very, very tempting because, that would be it. I would just do this chemo and I would be okay, not have to worry about, long-term complications. And I just, it was tempting to do that and just kind of take a gamble. And, even though my chances of relapse were super high, there's also a chance that it might not come back. But like I said, for me, in my personal case, I knew that transplant was what I needed to do because, the likelihood was just so high that my cancer would come back. I can't guarantee it, but it was pretty close to a guarantee, you know what I mean? And it just was right for me. And luckily, everything worked out well, and it all worked out good for me. So that's kind of how it all came about as far as which one to pick in my whole first visit with WVU. It was a lot of information, for sure, information overload there at that first meeting, but it was really good. It was a very positive experience. I met with the transplant coordinator, and she was the one who was in charge of like scheduling the transplant appointment, like the pre-transplant appointments, and she was the one who was kind of in charge of finding my donor and searching through the registry and everything. And and I met various nurses and things too. It just was a good experience. Highly recommend them. But yeah, so that's that, I think. So that was right there after I was discharged from the hospital the first time. And a couple weeks following that first visit, I was actually I was admitted to the hospital to do one round of the consolidation chemo. And the reason I had to do that was because even though I was in remission, and I had been for over a month at that time, they wanted me to do the consolidation round just because it was still going to be a little while before I was able to go and get a transplant done. And they wanted to make sure that the AML just kind of stayed at bay and to make sure there was nothing creeping up in my body in the meantime. So, I went, and what I did was I went July 24th was whenever I was admitted to the hospital. This was the same hospital where I got my induction chemo. And I was there from July 24th to July 29th, so it was a short stay compared to my first stay. It was only a week, not even a whole technical week. And what they did was they delivered cytarabine on day 1, day 3, and day 5. Again, it was intravenous, so it went through my port. But the delivery method, or I don't know what you want to call it, it was different. The first time I had cytarabine, it was a 24-hour drip. But this time they ran the bag. I cannot remember. I want to say that maybe the bag lasted 3 hours or something like that, but they did that twice a day on day 1, day 3, and day 5. So each day I got 2 bags in that 24-hour period, and then I would have a rest day, and then they would do it again all day, and then I'd have a rest day, and then on the last day they did it again, and then I went home that following day. So on my rest day, my final rest day, I got to go home. And it's kind of the way it clicked in my brain was, they called it consolidation chemo. So before with my induction, I got cytarabine every day for 7 days, but it was stretched out. So for the consolidation, they kind of they took the doses of chemo and they kind of just consolidated it into a shorter period of time, if that makes any sense. I don't know if it makes sense to you or not, but it made sense in my crazy head. So that's the way I remembered it, and kind of like made sense of, oh, okay, this is why they're doing it. But I'm trying to look at my notes here so I don't forget anything. So I was discharged on a Saturday, the 29th, and then that Monday, which was the 31st of July, I had to go back to the cancer clinic there, and I got a shot of Neulasta, which Neulasta, it's supposed to boost your white blood count and kind of help your marrow recover quicker. I did not get any Neulasta at all whenever I was in the hospital the first time. They wanted my own blood cells to recover and to see how long it took to like regenerate and things like that. So I didn't get any kind of booster shot, but I did get one shot of Neulasta on the 31st of July, and quite honestly, I don't feel as if it really sped up my marrow recovery, because it did still take a good couple of weeks before my counts are back up to normal, but maybe it did something else. I don't know. That's just kind of what I witnessed. I was kind of expecting my like marrow and everything to like shoot up like really quick, but that's not what happened. But I don't know. Anyway, so I got that, and then what I had to do was they gave me a standing order for CBC and differential, and I took that order to my local hospital, and I just would go there every so often, maybe every day, every other day, or if I was really feeling like crappy, I would go there and have my blood drawn to check my levels, and if my levels, if my my platelets or my red blood cells or hemoglobin, if any of that was low, then the the doctor, the local hospital, of course, would send my results to my oncologist, and the oncologist office would call me and say that I need to go get some platelets or go get some blood because my hemoglobin's low, and they would tell me that, oh, it's too late to come into the clinic, so just go to the ER. Well, I ended up going to the ER many times within that next couple of weeks because I had to go get blood and platelets a few times during that period. So that kind of stunk, having to go to the ER, and they didn't really know what was going on. I had to explain everything to them each time, and it just wasn't the most convenient way to get what I needed. But whatever, we got the job done. But I did have to, I wish I could check my phone and let you all know exactly how many platelets and blood transfusions I had to get, because I kept track of all of that. Let me see here. I had to get 5 platelet transfusions after the consolidation chemo, and I had to get 3 total blood transfusions. So in those couple of weeks, that's how many I had to get. One time I went and got my blood checked, and my platelets were so low, it scared me to death. My platelets have never been this low, ever in my life. They were 5. And for normal people, platelets are around 140 as the low, and mine were 5. It was terrifying. I was never so scared in my whole life. I thought that, I don't know, the whole time I was driving to the emergency room, I was just praying. I was like, oh my goodness, please don't get in a car accident or anything like that, because if I do, I'm gonna bleed out before the ambulance gets here, and all this terrible anxiety and all these terrible thoughts were just going through my head, because oh my, that is critically low. So it was an interesting time. Honestly, if I had to pick between being at home and going through that kind of stuff, recovering, or being in the hospital and having someone there with me 24/7, even though being in the hospital really is not fun, I would pick being in the hospital and having somebody there just to keep a very close eye on my platelets and my blood, because there would be a couple of days where it would, time would go by and I wouldn't have my blood checked, and I just didn't know. So, of course the anxiety was just high. But anyways, so that was that, and eventually, my blood levels did recover, and everything, got back to my new normal then. Trying to think here, looking at my notes. During consolidation, actually, I had just a little bit of hair growing back from the induction chemo, where it fell out after the induction chemo. So I had little tiny, random hairs, and actually that hair did not fall out during my first round of consolidation. I'm not sure why, but cool, it didn't fall out, so that stayed with me. And then also a major thing that I had right after I got home from the consolidation chemo. I'm not sure if you all had this experience or not, but whenever I was in the hospital, they did this whenever I had induction chemo also. But with the induction chemo and then with the consolidation chemo, they gave me eye drops several times a day while I was receiving the chemo. And I never really knew why. They always just said that, the chemo can cause conjunctivitis. And I was like, oh, okay, whatever. I didn't think anything of it, not really thinking. And then whenever they discharged me, they didn't give me any eye drops to take home. And again, I didn't think about it because, the first time I was recovering in the hospital from my induction chemo, I didn't, they didn't give me any discharge medicines like that, because I still, was recovering there inpatient. So they discharged me without any kind of eye drops, and I didn't know any better. And maybe it was even just the next day, I believe, my eyes started getting really dry, and like my vision got like really blurry, and like it just was hard to see, and it hurt. And then it just continued to get worse and worse and worse, and it got to where I could not see, and I couldn't wear my glasses because my glasses didn't help at all. Of course, like contacts were completely out of the question. And it just was the most painful. My eyes were so itchy and just dry, and it was the worst. I just absolutely looked like I was having an allergy attack, or like I was crying my eyes out or something. Like it was terrible. And I looked it up online, and it's called keratoconjunctivitis, I believe. And that's what those eye drops were preventing. Somehow the chemo can cause that. I'm not sure if it's because of the whole rapidly dividing cells being, targeted by chemo. I don't know if that's the reason for the eye issues or not. But I eventually was able to get those eye drops. I just blanked on the name of the actual eye drops. But as soon as I got those drops, like my world changed. Like it was the most wonderful feeling in the world, I tell ya. Because even like artificial tears, they weren't helping my eyes. Like I needed that prescription eye drop, and I got it, and it helped clear up the whole eye issue. It took a couple of days to completely clear out, but as soon as I got those drops, like I got some relief, thank goodness, because that was not fun. But other than that, I don't remember having any major issues really after the consolidation. I didn't have any kind of infections. I didn't have fevers, things like that. I was lucky. I didn't have major issues, other than just the eyes and then having to go get blood and platelets. But it wasn't terrible. But luckily, that was the only round of consolidation I had to do. The one round was enough. And then not too long after I had fully recovered from the consolidation, I was getting ready to go for transplant because they had found a perfect match donor. So I was very lucky with that. And I will get more into the actual transplant process and the donor and everything in a different video, like I had said before. So I think that's pretty much it for this video. So I'll wrap it up here. Like I said, my next video, I guess I can go ahead and start talking about the transplant process and all like the pre-transplant medicines and things that I had to get and all that good stuff. So I guess I'll do that for my next vlog. As always, like I always say, if you have any questions, just let me know down in the comments, and I will try my best to answer them. If you want me to talk about something in particular, just let me know, and I'll try to talk about it if I can. And just, stay healthy and stay happy.